As you know, Milwaukee County has the most COVID-19 cases and deaths. Are you preparing right now to have field hospitals and isolation centers open up in Milwaukee County?
We're preparing for it, absolutely. The Army Corps of Engineers has been working with our folks, as have other federal agencies. I feel confident that once the decision is made to do this, they're looking at sites, and frankly, I'm not at liberty to tell you what sites, but I know they're looking at sites, and we will be prepared when that surge happens. I feel very confident in it.
So we've been talking to some folks. We think the Wisconsin Center is on that list, State Fair Park. Are those two on the list? How big is the list?
Well, I'm not at liberty to say right now, but I feel confident that there's going to be adequate facilities, but everything that depends on procurement and things like that. But as far as the expertise and the manpower and woman power to make it happen, the physical, it can happen.
So I asked it in two questions there. Are these going to be large field large field hospitals?
They're looking at all options, Charles, all options. But it depends on the circumstances at the time where they make that decision. There's plenty of, if you think about Milwaukee itself, you mentioned two areas that clearly that it could happen, but there's also some vacant buildings that could be used also.
And so when you say it all depends on the surge, what kind of numbers do you have to see to activate this plan?
Well, when we see our hospitals becoming overrun, and at this point in time, I don't think that's happening. But we have a team that is set aside solely to monitor that every single day, 24 hours a day.
You have also asked for 10,000 ventilators. Is that a worst case scenario, or are the hospitals telling you they're going to need that many?
We believe that's a worst case scenario, but we want to make sure that there's a lineup for the ventilators, and obviously New York and California and some other areas that are already in the surge are in position to make those purchases. What we want to do is make sure we have that opportunity. We actually, for a while there, was working with Illinois and Minnesota and Michigan to collectively do it with our common purchasing power, and we got, I think the federal government ended up taking that contract away from us.
And we've seen that in other states, that the federal government kind of wins out here.
Yes.
But let me ask you, Wisconsin is a manufacturing state. Can they be made here?
We're investigating that, but there's always that possibility. We've had good luck with using Wisconsin manufacturers that are helping us out with the testing piece, some other protection equipment. But the ventilators are a whole other thing. But we're open to it. We're investigating it and seeing what manufacturing companies would be able to do that here.
Governor, as you know, safer at home has been very challenging on all of us, especially small businesses and people who want to go to work but can't go to work. As you're approaching April here, what is your calculation? What is your forecast now compared to a week ago?
Well, certainly we're not in a position to say we're out of the woods. We still have an increasing number of people being identified every single day, as another 100 some today. And so I believe that, I was listening to President Trump last night, and I think we're reflective of the rest of the country in a way. Milwaukee is reflective of Detroit and Chicago and the rest of the state, similar to Minnesota, I would say. So do I think we're going to be at the crux of things in the end of April? I hope so, but the virus will determine that, not me or anybody else.
And one of the best ways...
Also, excuse me,
it's
also dependent on how well people stay safer at home. That will be the defining factor.
So let me ask you that way. One of the best ways to sort of understand what's happening here, you're doubling the capacity for the labs to test for COVID-19. But is there a scenario where you see we can be testing 10,000 people, 20,000 people by the end of next month? April.
Well, it could be, but we're in a position now where that could happen. I mean, it wouldn't be 10,000 a day, obviously, but we are prioritizing people that are presenting the symptoms. And so I believe that do we need more testing facilities? Yes. Do we need more testing materials? Yes. Those are all short supplies. But I think we're in a place now where we have a good platform to build on going forward.
So when we had talked to people on our Facebook page that we were going to have a chance to sit down and talk with you, we got nearly 200 questions. And I know you don't have time for 200 questions, but I do want to begin with one here from Paul Morton. He says, with the numbers expected to increase, will you then revisit which businesses are essential? In other words, does that get redefined if the numbers keep going up, or does it get redefined as the numbers go down?
I'd say it would be redefined in both categories. I mean, but we will not be redefining essential anytime soon. You know, it's taking long enough for us to get to this point. I don't see us changing that, but at some point in time we may need to redefine it, and it could be either way depending on where we're at. But this was a major change and shift for our state. It's not something we can change week by week.
So when you look at Safer at Home, are we really in the two most critical weeks going forward?
I think so. Absolutely. The science is there. The way we get this thing controlled in a way that we can finally get rid of it is to quit infecting each other. And the way to do that is just to isolate at home. Safer at home. When we're safer at home, we're saving lives. Simple as that.
And so when you look at the physical health of people versus the financial health, how will you look to scale that when we start flattening that curve, when people will want to get back to their restaurants, to their small businesses, to get back to work? Will it be overnight, or will it slowly go back to normal?
Well, it won't be flipping a switch. I can tell you that. And also, we have enough data from other countries that if you do it too soon, you get another spike. You get a whole new section of what we have now. So we'll be very cautious. I understand it for our smaller businesses that are taking it on the chin. That's why I was very happy that the federal government is going to be helping out there. But at the end of the day, we need to follow the science, and the science tells us to be cautious.
You have spent a lifetime in education. Dawn Wallace asked us, will you be closing all schools for the rest of the school year? What guidance can you give on what the rest of the school year will look like?
Yeah, well, certainly we're hopeful that school districts and teachers, and I know this is happening in different ways, are reaching out to their students and continuing to have that ongoing presence in their lives. And I know that's very difficult for some folks because of internet and so on, but they're doing the best they can. But for sure, we will be following. We have a date of the 24th of April. The president sent one the 30th. There will be no school before the 30th. That's for sure. But we'll take, at that point in time, we'll take a look at it, and we could consult with our school districts and see where they're at and make a decision there.
Do you imagine a scenario where the school year would not be finished this year?
Absolutely. Yes, there is a scenario where if we continue to have a rise in the number of people that are becoming seriously ill, a rise in the number of deaths, then it could happen. Do we want it to happen? No, but we're prepared for that.
Governor, one final question for you, and it's a personal one. I know, as you have talked about, it's been very challenging for all people in Wisconsin. You are a cancer survivor. How are you meeting this challenge, and how difficult has it been for you?
Compared to small business owners and people that are dying and people that are sick, I got it easy. I'm feeling well. We're working hard. I have a great team of people, and I'm so proud of the people of Wisconsin. I have great pride, but physically and personally, I'm doing fine. We have a lot of people that are in dire straits health-wise, and we have a lot of businesses that are struggling. And so any minor struggle in my life it doesn't compare.
Governor, we appreciate your time. Thank you.
Thanks, Charles. Have a good day.